the first question I have for you, okay, we talk about genetics in a bunch of different words or terms that people may not understand. We commonly use aneuploidy, but let's talk about what exactly is an aneuploidy, and then what are some of the other things that we might, or that the people that are listening might understand it to be, like a chromosomal defect and other terms that we use for that.
As a genetic counselor, it's my job to kind of explain this in plain language to people. So our chromosomes are strings of genetic information in all the cells of our body. It's how our most basic genetic information is organized. Now, we usually have 46 of them, and they all come in pairs because we get one from each parent. That's how we get our mix of genetic information at the point of conception. Pairs 1 through 22 are just named their number, and they're going to be the same amongst most people. And then our 23rd pair, what we call our sex chromosomes, where most people assigned female at birth have 2 X's. Most people assigned male at birth have an X and a Y. So when we talk about...
So what types of things would increase the risk of having a chromosomal difference?
So most of the time what impacts our risk is actually age of the egg for the pregnancy. So the pregnant person, if they get pregnant through natural conception, their age, or if you're using an egg donor, the age of the egg at the time that it was retrieved. So age plays a factor because most people have their eggs within them since the time that they were growing within their own parents. But those eggs don't make one less copy of themselves. So their own chromosomes don't split off to make sure they only give one to each egg. They're going to get the other one from the sperm until right before we get pregnant. And so the longer they've been sitting within someone, sometimes those chromosomes don't want to split off properly and they can get stuck together. And that can lead to a chromosome difference. So I think a lot of people understand or have heard of before that, you know, if you're over the age of 35, you have an increased chance to have a child affected with a